Hello everyone, my name is Dr. Anne and today we're going to have a video about genital herpes. What is genital herpes? A lot of people will be exposed and carry the herpes simplex virus. Most people will have no symptoms and there are different strains of this virus. Some strains in some people go on to have symptoms. Genital herpes are a sexually transmitted infection. It causes herpetic sores, so small round lesions, which are painful blisters. These blisters are fluid-filled bumps which can break and release fluid. In this video, I'm going to go through the most important signs and symptoms and how to treat this as quickly as possible. In the last 11 years as a doctor, I've had many patients with genital herpes and have often explained how uncomfortable their symptoms are and often about the discomfort they feel or the embarrassment they feel with this infection. The aim of this video is to increase awareness and make sure we're having informed discussions and we know everything we need to know. This is how we reduce the spread and help destigmatize this condition. What causes genital herpes? Often when my patients come to see me, they'll say things like, "Doctor, I have no idea where this infection came from and I'm really worried about my symptoms." Well, often with genital herpes, we won't know where exactly it's come from if you've had multiple sexual partners. You could have had this virus for a while and just had no symptoms, so it won't always be related to your last partner. There are two main types of herpes simplex virus that causes genital herpes. There's other strains of herpes virus which cause other symptoms like cold sores. HSV1 are usually associated with cold sores, but in some cases can cause genital herpes. And then you have HSV2, which causes genital herpes in most cases. The herpes simplex virus gets into your skin through breaks in the skin. So usually from cuts or skin abrasions when you've got a broken skin barrier. Because the skin in your genital area is very thin, this is often what leads to abrasions and the virus entering this area. Once these viruses enter your body, they start to replicate and grow. When these viruses enter your cells, this is what often leads to symptoms. Genital herpes symptoms. When you get small blisters in your genital areas that look like this is what's classically described as an outbreak. Usually, most people will get symptoms around 4 days of getting the virus, but in some cases it could be longer. General symptoms for men include blisters on your penis, scrotum or buttocks. General symptoms in women include lesions in your vagina, anus or buttocks. Most people will end up with blisters on the areas or the parts of the body that have been exposed to the virus. In some cases that's in the face or the lips. The area often starts to itch or tingle before the blisters appear. The blisters may then become ulcerated and start to release fluid. Additional symptoms that you might have with herpes include fever, headaches, and body aches. Often what I find with my patients is they're really run down and tired when they have a herpes outbreak. When to see a doctor with genital herpes? Well, I just want to highlight again that we're not here to judge you, we're here to support you, and these symptoms can be really uncomfortable, so it's best to see us. If you have no symptoms, you don't need to see us and you don't routinely test for HSV. However, if you do have symptoms of genital herpes, we can do additional tests for the virus. To diagnose genital herpes, we'll generally have a look at your genital area and examine you, looking for the lesions. Then we might do some blood tests or lab tests by taking a small sample of the fluid and sending it to the lab for testing. How are genital herpes treated? Well, as I've explained in this video, genital herpes is caused by a virus, and for the virus there's no cure, but we can treat the symptoms. And just to reassure you, there's lots of other tips I will give you in managing your symptoms. Number 1, medications. Antiviral drugs, especially when they're taken early on, can help speed up the course of the infection. So the bottom line is to get treated early if you notice symptoms, as they may help to reduce the amount of time you have symptoms. When you start to notice tingling or stinging and you know you have herpes, then it's a good idea to start the medication soon. Some outbreaks can last up to 3 weeks, so the aim of giving medications is to reduce how long you have the symptoms for. Common prescription-only medications from a doctor include. There's also different formulations of antiviral treatment, so in some cases we use creams. They're generally though not recommended for genital herpes. You might use them for oral herpes. There's currently other treatments which are being researched, so watch this space as new treatments develop. Home remedies for genital herpes. Here I'm going to go through some top tips as a doctor for when you have an outbreak. Keep the area clean and dry to prevent additional infections developing. Gently wash the area with plain water and make sure you pat the area dry with a clean towel. This is because on top of your herpes you can develop additional infections like skin infections, and we want to prevent them from developing. Use cold compresses. If the area is stinging and tingling, you might want to use a cold compress on the area to soothe it. This can help reduce the pain, itching and inflammation you get. Number 3, you might want to use a barrier cream, so a plain unscented moisturizer in the area, and this is because you want to prevent additional skin cracking and maintain your skin barrier as much as you can. Avoid tight clothing. Wear loose-fitting, comfortable, breathable clothes to allow the skin to heal. If you're having an active infection, it can be really difficult to pee. My top tip is to pee in the bath if you're having really stinging symptoms, and then you can shower or wash yourself after. Pain relief. You might want to use paracetamol or ibuprofen if it's safe for you to do so to help with the pain that you experience. Keep your immune system healthy. This involves just making sure you're drinking enough, eating well to allow the skin to heal as quickly as possible. Practicing safe sex. Do you always need treatment? What happens if you have no treatment? Well, genital herpes don't always require treatment. If your symptoms are quite mild and easily manageable, you may prefer not to use treatment. The blisters will generally heal up and clear up on their own, but just to highlight, they can be very painful, so if you have the option of treatment, you may prefer this. What should I do if I'm pregnant and I have genital herpes? Well, it's really important to say it's normal to be concerned about your baby, and it's important to see a doctor if you're concerned. If you have this virus, it is possible to transmit it to your baby, especially if you have an active infection when you're giving birth. The good news is, if your doctor is aware, we can give you a preventative medication around the time of delivery to make sure we prevent the outbreaks as much as we can. One of the first signs of genital herpes is itching and irritated skin. What do herpes sores look like? Herpes sores usually look like pus-filled blisters, which then break open to ooze fluid. You may just have one, often you have a cluster of them in an area. Another commonly asked question, is genital herpes contagious for life? You're more likely to transmit HSV if you're having an active infection or an outbreak. This is when the herpes outbreaks first appear before the skin is fully healed. However, even when you have no symptoms, it is possible to spread the virus to your partner. Therefore, it's really important to have a discussion with your partner so they understand what's going on. You could then decide you prefer to use condoms to reduce the transmission risk of the virus. Can you get herpes from kissing? As I've explained before, there's 2 types of HSV virus which are associated with genital herpes. If you're kissing someone with an active sore, then it is possible to transfer the virus. Can you get herpes from oral sex? Yes, genital herpes can be transmitted from oral sex, especially if the person performing the oral sex has an active infection. As a doctor, I firmly believe that knowledge is power, and therefore having the right information at your fingertips on the computer really helps people to look after their health. If you write a comment below, I'll get back to you and respond to your questions. If I can ask for a favour, if you can click the word subscribe, it really helps my channel to keep growing and for me to keep producing high quality educational